That's how many doses of the Pfizer vaccine, specifically for kids aged 5 to 11 years old, began shipping yesterday, according to President Biden's coronavirus response coordinator. Shipments began minutes after the shot was given final clearance from the Centers for Disease Control and Prevention. The decision ushers in a new phase in the U.S. pandemic response and widens access to vaccines to about 28 million more people. It's all happening at the same time as Americans who received shots earlier in the pandemic are lining up for booster doses. So here to discuss all of this is Amish Adalja, senior scholar with the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Dr. Adalja, thanks as always for being here. So first of all, I want to start with this. How will this clearance impact the nation's trajectory out of this pandemic? What do you think?
Well, the more vaccine that goes into people's arms, the harder it becomes for the virus to spread. So in general, when you have more people immunized, you're going to have it harder for the virus to spread. So that is a positive. But when you look, for example, at other aspects of the pandemic, which I think are probably more important, including hospital capacity, vaccinating 5 to 11-year-olds isn't going to really make it easier to work in a hospital or to free up hospital capacity. We still have many people above the age of 18 that are not vaccinated. And to me, those are the most valuable vaccines to go into people. Those going into people who are most likely to need hospitalizations and to impinge on hospital capacity. But it's great that 5 to 11-year-olds can be vaccinated.